Dear viewers, hello and good morning to everyone from the second day of the second Marmara International City Forum, MARUF 2021. We are now on the third session, Pandemic Resilient Cities. I would like to welcome the session speakers both on behalf of Union of Municipalities of Marmara, on behalf of the Istanbul Police Center, and on behalf of all police officers. First of all, my name is Canan Tunçtürk. I also work as a senior expert at Istanbul Police Center. I'm a candidate for doctoral political science at Bilgi University. I'm doctor candidate, PhD candidate. I would like to talk about the panel first. Our panel will take place at 2. You may have heard something. You have experienced lots of things from yesterday to today. But let me tell you anyway. Let me remind you. You can change the language options. You can change the interpretation option as you like. Sometimes I will turn to Turkish. Sometimes I will speak English. So this year I'm a member of the executive committee. I've been working in MARUF with an amazing team for 1 year since the beginning of February.
Working we let's act together, and our municipality has chosen 6 themes: healthy, steady, innovative. In our panel of resistance to pandemics, I think that, of course, pandemics are bringing us problems, and we are going to talk about pandemics, what should be done, and main problems, how can we cope with those problems, and how can we fight against these problems. I just wanted to say,
kaynak 2011 yılından bu yana Sağlık Bakanlığımızın Sağlık Bilgi Sistemleri Genel Müdürlüğü bünyesinde danışman
working
olarak
in
çalışıyor.
the general management of the
Uluslararası Projeler
Ministry
Yönetim
of Health.
Koordinatörlüğü
He is
çatısı
a
altında Dünya
coordinator,
Bankası'nın projelerini
and he
yürütmesi, ulusal
is
ve uluslararası
responsible
alanda
of the
proje
World Bank
geliştirme ve koordinasyon
projects
çalışmaları
as a coordinator.
yürütüyor. Profesör Doktor Zeki Kılıçarslan, Birlikte Hocam İstanbul Tıp Fakültesi'nin Göğüs Hastalıkları Anabilim Dalı hocalarımızdan.
Faculty of
94
Medicine of the
yılında
Istanbul University.
profesörlüğünü
He
almış
has
Doktor
become a
Zeki Hocam.
professor in 1994, and he has worked in the field of pulmonary diseases. And he has worked on tuberculosis, and he has received many awards. And Levent Hoca, sorry, there's a problem with the sound. I think a problem with the connection.
2017 and 2018, and we had a chance to work with her for a year. And she holds a PhD from University of London on anthropology with a focus on migration. Son bir not, çok da uzatmadan geçeyim. Oturumumuz 1,5 saat sürüyor.
We're going to have 20 minutes, and then have a half an hour for the question and answer session. So to be interactive with your participation, yes, we shall be very happy to have your questions. I want to give the floor to Ikaida, since he is going to give us information about the work of the Ministry of Health. Dear guests, and I would like to greet you and welcome you. I'm very happy to be with you. Thank you for having invited me. The Ministry of Health, of course, is has to get ready for a pandemics and not at the last moment. Of course, planning has to be prepared much in advance. And in this planning, vision is very important. Vision and foreseeing, to see the future, to foresee the future. That is very important. You have to have the right planning, you have to have the right strategic steps, and you have to use your resources wisely. And what is even more important is to have the correct data. Data is very important. It is the key of everything, actually. Politics and strategies are based on knowledge. So everything is based on knowledge and data. Therefore, we have to be concentrated. I'm very sorry, but there is a problem with the connection. I cannot. And readiness. And well, to be ready is especially within the process of developing project is very important. You foresee the future, yes, but what are you doing? You have to get ready. Are you ready? Planning and strategy defining, what it's one of the most important steps, and I'm talking about readiness. So for all potential pandemics and crises, you have to be ready. The individuals have to be ready, but the state have to be ready with the infrastructure. We have to change and transform ourselves. I am very sorry, but there is a problem with the connection and we cannot hear. In 2011, when we look at the infrastructures, we have completed the. In 2014, this we started with the process of transformation for a new system of management. So what did we do? During the pandemics, the e-pulse personal system. So we have 53 million of users, 700,000. It is an organization where not only a platform when you see the health data of the citizens, but it is a very efficient platform where you can reach knowledge for enables e-pulse. It is a system of support. Actually, where data is transforms into strategy and action, and that is very important for our health system. On the other hand, that this is also the hospitals, like the city hospitals, which use health services, have been a very valuable tool in pandemics. Now we have 13, and as a total more than 20 projects of city hospitals. So we want a digital medical quality. and there is a vision of readiness. In the last 15 years, in 2021, we had 50% increase in intensive care possibilities. So I think that readiness is important. Now, were we on the right track? This is what we have to measure. We can say that between 2015 and 2017, TÜSİAD and Turkey Bilişim Association and the world, we had been selected the best company concerning digitalization. And in 2016, we had the best health award, and that it was really an award which had shows that we were on the right track. No, so what's this for? There is an application which is called in Turkish "Life Fits into the Home." In 2010-11, we have been concentrated on the integration and cooperation. Each public hospital is integrated into the system, so we wanted to have since 2015 we're working on the transmission of data, and think of it as a web. And a spider web. It is a spider web, a web which connects all of Turkey. In the pandemics, this has been very useful. And I want to talk about the host application. Since the first day of the pandemics, we have prepared then the CES code has been questioned for 66 billion times. So the HES code can be prepared in 3 seconds and can be transmitted. We have, if 5 million people are connected, it takes 9 to 10 seconds at the latest. And not only the HES code, but also isolation and the follow-up. And is thanks to this solid network, strong network, we have managed. We have 15,200 people who have visited the people at risk at home, and you could go around the world 2-3 times. This was really serious work, and an affiliation rate which was and visiting rates which was over 95%. We had 53.7 million minutes of phone calls. We also had a plan for corona prevention. Since the first case, we have started 8 days later, and in the 6th week we had 2.1 million cases who had a risk assessment. Of course, I just want to show you that in the US, the corona risk score started later than we did, and we were really started acting much earlier than other countries. Besides that, HES just and corona measures have been promoted, and we are continuing to work and to develop. This is not a stagnating system. It is an ongoing service. Of course, it is difficult because pandemics sometimes is, of course, we sometimes get tired, but the pandemics does not get tired. So, and the second point is the management of change. So you make an application and then you test and see if there are some lacking points, and to have a more updated version. Of course, this is very important to have the procedure and the methodology. But since it was an urgent case, and of course we did not have time to wait with the pandemics, and we have sometimes problems with the procedure. And the third problem is to manage the pandemics without stopping life trend and lifestyle. Of course, but we have, life goes on, but we have to fight against pandemics. And when you look at the heroes, which are the health staff, we do our best, and we are doing the maximum that we can do. And that I wanted to inform. Thank you very much for having listened to me. Thank you. These were very valuable views, and of course, the accessibility. This is a platform which is really accessible, and how to use it wisely. Of course, the pandemic started all of a sudden. It took that to have the necessary, even if we have been caught unawares, but the Ministry of Health program is based on the prior preparation of the program, and now I want to give the floor to Zeki Hoca. Now, you are very valuable as a doctor, and when we talk about the health services, especially in the pandemics, how do you look at that? Thank you. Yes, yes, really, I approve most of what has already been said. The pandemics of COVID-19 showed us the importance of health in the daily life of people and in the economic life of people. Yes, of course. Health has a social dimension, an economic dimension, and the development of public health and to have a general health insurance and its importance. This also, when you look at the American system, this is like the general health services, market-based. Actually, it looks like a self-criticism. Health should be integrated and it should apolitical. It should be an apolitical priority. So it should be common to all political parties. Now, of course, public health. These are very concrete realities in Europe. public health is integrated in the politics of most of European countries. So our health system is also quite advanced in this field. We can see how the Ministry of Health works. Health is a social and economic dimension of our life. So we're going to talk about green areas, how long will people walk to reach the hospitals. So it is the fauna and the flora around the cities. It is, what is the real system which has a social dimension. Health has a social dimension, and to fight against pandemics, it is a multi-sector and multi-dimensional service. Now, to prepare against pandemics or to fight against the pandemics, yes, of course, this is like it is not intensive care to fight against not only but infection. So if we know that that patient is sick and but what starts there? That we think that this patient can infect somebody else, and the people who are in contact with the patient have to be isolated. Now, to be able to do that, you have to convince the people of the important to make them aware. Now, of course, they say we need social and economic support so that the patient is aware of that. Now, he or she has to tell you who they contacted now before started getting sick. Who were your contacts? So maybe the system can find these people. Now, if as a management you look about different sectors, so there are many speculations which can have an impact. Now, this is we have to work together and the sectors have to coordinate. When you look at technology, of course, we use this. Now, how we should be careful about unnecessary treatment or wrong treatments. So technology is very important in our health system. So I really support and thank the Ministry of Health for a very positive attitude. What have we experienced? I think we had two problems. It is not only the problem of the ministry, but it is really it can start only with a cooperative work. Everyone has to get ready. We have to walk towards a common target. And how can we have this management? This is what people said that there were some preconceived idea and there are so we need a good integration. Uh, uh, uh, so there are some preconceived ideas. So even if you have the right knowledge, people are suspicious. They do not trust you sometimes. So you can only be successful if you can join all the factors and all the different groups around the same idea. So we need the support of all the sectors. That is the only way of being successful. Now, of course, I talked about the social dimension of health. Now, of course, the health systems most of the time are successful. These city hospitals have been a subject of discussion because they think of a hospital, a big hospital, which is far away from the city. Look at the pandemics, people are sick and they have to take the metro or the taxi or buses to go to the hospital, which is out of town. But with the same resources, you can have 10 what we call city hospitals, which is, it is not only a question of pandemics, it is a question of general health. Our population is aging, so people have to be able to be near the sick member of the family if he is in a city hospital. It is really more practical. It is accessible and it is important to have these city hospitals to serve the needs of the population. I think that the ministry, of course, this is not only the ministry, but it is a general policy which has to be taken into consideration. Of course, we need each sector who have to be to give a direction, to show the way, and the participation, inclusion of the population. Public inclusion is important. But I think that when we look at health is a social, economic, and political dimension. When we look at civil society, we have a campaign which is an international campaign. We want vaccination. Okay, there was a pandemic, and see, we have a new vaccine which is efficient. Since the pharaohs, we have 1.5 million people. Tuberculosis. Do you know when a vaccine against TB was found? 100 years ago. You know its impact? It only prevented the death of children, but it does not stop people from getting sick. It's already 100 years ago, and millions of people die every year. Why isn't there a vaccination? Yes. So I think that was one of the United Nations in 2018 has made a special meeting concerning TB because millions of people are getting sick and are dying. Of course, if there are no migration, there is not really such a need. Look at the social economic dimension, like millions of people are getting sick. These are not only old people, which are, it is a disease which attacks children and young people. So health is a social topic, and it is a multi-sectorial. We need such an attitude. Thank you very much.
And thank you very much indeed, and especially, and I would like to ask about the second round of I want to be vaccinated. And you have said that life is and health is social, and health is also political. Yes, we need to underline that fact as well. And actually, you have mentioned about the importance of the governance and also the importance of the trust in this equilibrium actually, and also the support of the socio-economic support provided to the citizens, and also coordination of the social support by the central government, non-government organizations, and also the local governments. And I would like to thank to Mr. Zeki for such a comprehensive talk. And actually, and we have, and actually, and so we will be having 11 minutes actually. And so, and how was our mobility during the COVID pandemic situation, and how sporty we were during the pandemic situation? Can you please open your mic and actually to some of the mistakes that we are not used to speaking in front of cameras, of course. And good morning to everyone. So welcome to our session. And actually, one of the mottos of Maruf is, as you know, the be mobile, be mobilized together, act together, move together, and actually let's move together and let's act and let's be mobilized together. And actually this the health resilient cities was the aspect actually, especially during the medical concepts. Actually, three different elements were on the front line. Actually, they were emphasized very much indeed. Dieting, and also dieting, mobility, and also regular sleep patterns. These three aspects were always mentioned actually, as you know, that as the three pillars of for having a very sustainable and resilient immunization system in our country, in our bodies. And actually, as actually our activities is for actually regulating and promoting the mobilization of the country. And of course we need to look at the sport. Everything may be called as support, all exercises actually. And however, when we name it as a support, we think that it should be something professional, it should be something that needs to be, you need to have a license. No, it is not actually. So when we say that something as a support, it can be anything that make you mobilized and that you make you active. And I only after, and actually in some areas physical activities, and of course actually then it has a preventive role, and it has also corrective role, and also recovery role in every aspect of our well-being and our health. Because therefore before getting sick, if you sport, if you do exercises, of course it will be preventing you getting sick or getting ill. And of course, so there are and actually everybody knows actually when you put two goals and a goalkeeper, everybody will understand that they will be playing football there, and therefore actually sporting has a universal language actually, and it's even then you can attract the migrants and all the people under temporary protection, as well as the fundamental needs, security, safety, and dieting, accommodation, sheltering. These are the, as the basic fundamental needs of the human being, and then comes the exercising, and also and enjoying your leisure times, your free times, and participating to different exercises in guidance of of a person, of a lecturer, or maybe on exercise coach. And actually it will be something that will be relating to what other people will be doing in their free time. And actually when we look at the actual working patterns, and the urban working patterns are almost very similar or almost identical to each other actually, and however the only difference comes from the leisure times, from the free times, and therefore we need to inject this sporting and exercising as a part of our daily routine life. And unfortunately in our country it is considered that needs to be handled only when we are completely free, and when we don't have anything to do. And during the pandemic situation, we have seen that the people try to do something in front of their TV sets, and by means of opening the YouTube videos, and also trying to support at the beginning of the pandemic situation. And actually sometimes we need to address to the people that we may refer. For example, every neighborhood have a neighborhood doctor, and we have national police actually, and we know, and we don't have, and for example the family sporting coach or family exercising coach. And actually like we do have a police that is responsible for our neighborhood, a doctor that is responsible from our neighborhood, there should be sporting and exercises coaches actually that will be responsible as well from our neighborhood as well. And actually, as you know, that after the dieting during the pandemic situation, we have seen that especially in the social media environment, many people try to show actually the importance of the exercises and the sporting. And during the 1999 earthquake in Kocaeli, I was actually a part of a project. And after solving the dieting and the sheltering problems of the people, and actually the after creating the child friendly environment for the children, and I heard the sentence from a child that thank God that this earthquake happened. And of course you don't don't need to misunderstand this sentence, because it was saying that their life was really empty and they were doing really nothing before the earthquake. And that is why actually that the children spelled like that. And actually, as the previous speakers have mentioned about the data, and of course as you know that and even and the world tried to reach to somewhere actually by learning the preference of the personal car brands on a neighborhood, on a street. And unfortunately exercise and also sporting is a lame leg actually for the country, for our country. And as you know that everything is balance, has a balance in our body, and when there is something higher than the other, then the stability of the body is spoiled. And therefore, as we diet regularly, as we sleep regularly, then we have to exercise and we have to do sporting regularly as well in order to keep the body in equilibrium situation, in a balanced situation. And that is why actually the cities require actually collective and also combining and uniting environments and opportunities without politicizing people, without discriminating the people, of course in proportional and in line with the skills and capabilities of the people, considering of course the age of the people. And actually this unity, this collectivity needs to be used for other purposes as well, because if you can combine the people for exercises and for sporting, then you may use the same group for other roles. And actually, so these people, if you can constructively direct these people, I sincerely believe that sporting can really play a very important role for actually recovery of the people, and for improving the conditions of the people, and for creating and the exercise culture and the sporting culture in a neighborhood. And as you know, actually, even in the international convention of the human rights, declared by the UN, and also the similar conventions and the agreements of the EU, especially emphasizes the importance of the freedom of mobility and also the freedom of exercise and sporting of the people. And actually, in order to be able to do that, accessibility needs to be taken into consideration. We don't have to move too far away from our residential areas actually just for the sake of sporting or exercises. Then it should be, if we can solve it for anything for our neighborhood, and then it will mean that we can solve the same problem for the district, for the city, and also for the entire country as well, because everything starts from the neighborhood, very close to our home and our household, because the neighborhood is the closest point where you can touch to a family, the members of the family. And as the previous speakers has already mentioned, they have mentioned about the technology, use of the technology, and also the use of the data coming from the sporting and exercising areas. And actually it is something that we really lack, and because as you know that sport and exercises have also very high flow of data. If we could capture this data, of course, and of course non-politicized aspect of this sporting and exercises has a very nice opportunity, provides a very nice opportunity for our country as well, for overall improvement of our lifestyles. And also it may also inject additional energy to the society, like the case, remember that whenever the Turkish football team wins a match, actually we forget all about our problems in daily life, and we enjoy that victory all together as a nation. And it can be the same actually on the lower scale for our neighborhood. When we do a part of the exercises or sporting, we may enjoy the same feeling every day. And actually in some cases, as you know, that sport and everybody thinks that so you can see us in suits most of the time, and you may think that sporting requires very special outfits and also training exercises and the materials. But no, sporting and exercises can be a part of our life in every moment where we are, and either in our workplace and or the physical area. And actually so we can we can actually share between each other, and therefore there are different project applications, and the project recommendations are received from different segments of the society, and therefore I may have a recommendation to the union of Marmara Union of the municipalities, and actually there are some concepts of the union of the, for example, healthy citizens, and union of the resilient citizens, they exist, and union of the sportive cities can be, or exercises cities can be an example, for example, and therefore I sincerely believe that Marmara Union of the municipalities can have a combining effect for that, and therefore and I think that the sport union of the sporting municipalities can introduce a broader aspect and added value to overall nation and regional policies and the decision makers. It may converge people to get together, and actually in the academic studies, actually I see that especially there are sister cities cooperation, and there are sister municipality approach with the different countries, and however there is no sisterhood or brotherhood with the adjacent municipality, as they may be a part of the, for example, between the Bursa and Kocaeli, and the Bursa and Kocaeli may have some common projects, and also city for example Istanbul Metropolitan Municipality as well, they can come together, they can create common joint projects together, and even though these cities have sister cities in the part of the different part of the world, they do not have any relationship between each other, just because that they are from different political parties. And for example, for the prevention of the cardiovascular diseases, as you know, that yes, exercises and sporting do have a very major role, of course, and therefore as we know that especially the people have very high power and capability of producing the new projects, and therefore Marmara Union of Municipalities can have a leading role in that, as they have the culture of producing the new concepts and the new projects. Even though we may not come to the common grounds on this opportunity, of course, then we may further discuss, and we can come to a common agreement on the proposals on the, and therefore I really attach great importance to every incident that will enable the people coming together. We don't need to wait for the funerals or the weddings to come together as a society, and coming together does not necessarily mean that you will be singing the same song, or it does not necessarily mean that you will not be praying together, or you will, and actually coming together means that that there is something on the ground that you can share together. And actually, and so I would like to emphasize several concepts here, and actually the sportive people approach, and also the sportive cities council or the union of the sportive cities should be established, and in order to make the people and make the urban people to be more mobilized and to exercise better. And thank you very much. And before this gathering, and before this unity and combination of the power, and actually so, and you have already mentioned about the, and actually, and actually when the people come together, when you create an environment for the people to talk, to chat each other, and there is an understanding that and so face to face talk is always actually better than any other type of the communication. And also actually from the local to the regional, from the regional to national, and then final to the global. Of course, we need to mobilize to the all people in order to actually eliminate the resistance and immobility against the immobility of the people. And actually, so it is really so important to use the sportive as a merging actor or merging elements, especially in the during the disaster of the people, and even during the earthquake, as you have mentioned, and especially during the recovery period, and during the psychosocial support period of the people. Yes, you are very right that the sporting and exercising actually play a very important role. And actually, so I would like to pass to a very vulnerable group.
Working on one of the most vulnerable groups, migrants, and you have field research on this. Could you please tell more on about your about the situation of migrants during this pandemic period?
Firstly, thank you, Jenna, for the opportunity to talk today. Thank you to the fellow panelists for these very insightful talks, and thank you to our participants. So far, as you covered, we've talked about health as a political social issue, digitalization and institutional preparedness, and well-being, sports, kind of the importance of movement itself, which became so much more clear to us when we couldn't move anymore within our cities and even within our towns or homes sometimes. And here I'm continuing with these themes, but somewhat more with a focus on issue of migration. And in this case, forced or voluntary, and the way that the pandemic has kind of impacted this, whether within Turkey, but also at a global level. So at the start of the pandemic, we ultimately directly started to witness countries closing their borders and this intensification of people actually leaving, non-citizens leaving and returning to their countries of origin because either they lost work and their, for instance, work permits were withdrawn, or they couldn't access healthcare, and the uncertainty of how long the pandemic would continue for. These were all factors that affected who remained, how they remained, who left, and also where they went to in many cases. And while for some migrants, the pandemic pushed them back, pushed them to return, for others, actually, it became a reason to remain in the country or their host country, because their labor suddenly became so much more essential. And this is particularly, for instance, migrant workers, and in some cases, refugees are included under this, working in agricultural sector, working as healthcare workers on the front line. Their labor was suddenly became very essential in a way that it had not been perceived in previously, prior to the pandemic. And the pandemic occurred at a time when there are over 280 million persons, and this is what we formally know as persons who were migrants, mainly labor migrants. So this is people who actually have status of some kind, maybe like a work permit, etc. And this is not looking at people who have migrated. People who have migrated but do not have actually status anymore. And so these figures are from the UN institutions, as you can see. And according to UNHCR figures at the end of 2020, there were over 20 million persons who actually registered as refugees. And there's various statuses there as well. But the importance of these figures for us is that then when we consider that 60%, for instance, of refugees actually live in peri-urban and urban settings. And this is why this is important, for instance, in this panel, because then with the pandemic, this then created exacerbated situations, as the majority, for instance, of refugees living in peri-urban or urban settings tend to live in lower income neighborhoods. There's an issue of housing, there's an issue of living conditions, labor access, etc. And all of this was more negatively affected with the start of the pandemic and the subsequent lockdowns. For migrants, the situation distribution geographically is somewhat different, depending on which sector people are working in, which migration trend or pattern they're following. So the situation there is a bit more varied, but for refugees, there's an increase of urban refugees. And with this comes an increased need for policies that address these people's needs. For cities and local urban actors, With the start of the pandemic, it became, a key consideration. How are we going to respond and address these needs, whether for citizens, whether for refugees or for migrants? And this was at a time, the pandemic kind of started at a time when we've already had this growing recognition that actually cities play a key role here in addressing the needs of refugees. So cities of sanctuary is, for instance, one example, but for instance, Turkey, there are many examples of different municipalities that have been very active in supporting refugees in terms of kind of harmonization activities, language activities, etc. But then with the pandemic, what was going to be their role? How were they going to do this? Then became the key questions. And these kind of remain key questions after the pandemic as an issue of preparedness and future policy. So with the start of the pandemic, for instance, in Istanbul, there was certain support, emergency support that emerged, that was provided, but with the protracted nature of the pandemic, this support was no longer present. And as has been mentioned kind of in previous panels, the pandemic resulted in the deepening and entrenchment of divisions and inequalities. So this was in terms of work, in terms of access, whether to education, healthcare, social protection, some of the issues that Zeki Hoja spoke about as well. And this is not just for refugees or for migrants. This also extends to segments of citizen populations. And so you have to think of all of them at the same time in a way. So the pandemic kind of raised the key questions, right? Whose work could be switched online? Who could continue to work? Who lost their work? Whose work was deemed essential and they were given, they had to continue, but they were expected to continue both for economic reasons and as let's say healthcare workers. Who had access, for instance, to the necessary internet, the necessary materials so that their child could continue their schooling education? As you mentioned, this is a key issue as well. Whose space in their house actually enabled them to, for their child to continue their education? Whose didn't? Who was excluded in all of these processes? So if we take an intersectionality approach and we consider how, that it's not just the person or the social being, but it's a person who has a gender, has an age, has perhaps a disability and ability, and then compounded with the pandemic, how do we respond to these various needs? How do we respond to this person who might be a migrant, might be a refugee, might be an older adult over 60, might have a reading disability, for instance, or visual impairment? And what do we do in those cases when we're faced with something like the pandemic? Research has been carried out in the pandemic. Most of it was done actually online rather than field research. And I'm going to refer to some that have actually been published, so if people want to read them, they can. So research carried out by Kritçioğlu and co-authors. This was in the initial phase of the pandemic, so it was among both Syrian refugees and Turkish citizens. And they were comparing the effects of the pandemic in the initial phase on both populations. And they found that Syrian refugees were more negatively affected by the pandemic and lockdown rules, especially in the case of families and individuals who rely on daily wage labor. Who don't have a safety net in terms of savings, who don't have relatives abroad who are able to support them with remittances. This can also be replicated for other, for instance, for let's say certain migrant groups, or we could also say even for, in some cases, some citizens, this might be the same case if they're internally displaced or in a particular situation. Focusing on the case of Istanbul and refugee labor again, and this was in the initial phase of the pandemic based on qualitative research. This was Nimir and Rotterman, and they explored the ways that actually the pandemic affected Syrian refugees who were working. And they found that whereas the situation maybe was precarious because the majority of refugees are working in informal settings, the lockdown then pushed these refugees into hyper precarity. So this pushed people into a situation of hyper precarity due to the lockdown, loss of work, loss of income, and increased kind of uncertainty, both economically and from other factors about when the situation would change. And this is not exclusive or solely representative of experience of refugees, and it's not necessarily the experience also of all refugees. And so it's necessary to also acknowledge that there's diversity among populations, and it's not just Syrian refugees as one homogeneous group, but there is a diversity in how the pandemic affected people, who was affected more, how were they affected more. And this is necessary for kind of policy considerations. So increased vulnerability due to the pandemic crosses the divides of citizenship and legal status. And this issue of how vulnerability may cross citizenship lines or may cross legal status lines actually has been discussed from prior to the pandemic, but the pandemic made it much more central, especially as we've seen, debates about who should access healthcare or be denied it, for instance, who should access vaccines, who is being denied actually access to vaccines, not intentionally, but in some cases it happens. If you don't have status, you can't access. This recognition of the ways vulnerabilities crosses boundaries of citizen, non-citizen comes at a time when we're witnessing the rise of popularism and increased racism directed at refugee populations and migrant populations, and this is both in Turkey and elsewhere in the world. Cities and urban actors actually play a key role here, and what will their role be going forward is something that needs to be discussed, because we need to start considering if we're going to talk about resilient cities, this is not maybe just an issue of health, but the health of the city is also how do you respond to these rising tensions? How do you respond to this emerging violence, especially when actually it comes down to should someone, for instance, have the right to access health or not, which is can be a life and death situation. So I'm going to end here. So if we look at the ways the COVID-19 pandemic has affected and continues to affect different segments of populations in diverse ways, as well as accounting for the ways intersectional dimensions affect, the increase of vulnerability, can lead to an increase in vulnerability, then this is necessary for any approach to talking about resilient cities or, kind of future resilience in this current situation of post-pandemic to some degree, because it must include policies and strategies that also make cities more inclusive. And inclusive here is not just for refugee, let's say, or migrant populations, but also inclusive of diverse profiles, of diverse people who may have ableism issues or, for instance, language barriers, etc. How do we respond to these diverse needs? Because actually it was this diversity of needs that became problematic during the pandemic, because people could not access if they did not have language, did not have internet, etc. So how do we actually address these issues when we want to think about resilient future cities? Thank you.
Suachum, thank you. While talking about resilience, this concept of inclusiveness is really important. Access to all these services, work, health, education, all these terms. Yes, you talk about the one of the most vulnerable groups, migrants, but from the sentence, you can take Istanbul off, you can put Gaziantep, or you can take Turkey off, you can put another country, or you can take migrants out, but you can put the people with disabilities, children, the other vulnerable groups. So this inclusiveness is really key here for the resiliencies, and thank you for your presentation as well, and thank you for being on time. Now we have 27 minutes left. 27 dakikamız kalmış panelistlerimiz. O yüzden
We have 27 left. We have 27 minutes left, and actually I will be giving 5 or 6 minutes of second round of talk, and actually starting with the İlkay Bey, if you would like you to share your actually field experience with us, what you can share with us.
Thank you very much for this information, and we are going to use the information given by Professor Zeki, and I wanted to take an opportunity. I make my morning exercise, so I really feel good. Now, since we're talking about the groups, the Ministry of Health has also other applications besides the corona measures. As the Ministry of Health, we have to examine all the possibilities. We have to think that everyone gets a health service in a fair way. Well, first, we have social distance rules, and many people had to work from home, and life fits into home. That's what we have to do. It's good. You watch television, you make your sport, exercise at home. And within the pandemic conditions, for this health staff have children, they cannot leave them alone at home, but they have to go and work. On the other hand, we have special children with special needs, like autistic children or other children with other problems, and it is, of course, in the restriction period where life fits into home, they are facing difficulties. So we developed two applications. This is the first application is that psychological support. Psychological support for the people who work on the field, and also a special support system for children with special needs. So within this pandemic, what they need psychological support. So that was a program dedicated to this, and because and for people who had to go to the hospital, we also developed the doctor e-pulse, so you can contact your doctor on the video and a medical check. So that has also been implemented. Now, you know, this pandemics is multidimensional, and well, some things you have to learn on the way. Yeah, that was, of course, a difficult time for all of us. Of course, people are well-intentioned and they are acting in order to try to improve things. Of course, the methods can be discussed, the systems can be discussed, but what we want, I mean, we want to get rid of the mask, we want to get rid of the pandemics and go back to our normal life. That's what we're hoping. Now, as a Ministry of Health, we want it even more than you do, because we could not go on holiday, we could not see our families, our spouses, our children. We had to spend sleepless nights. So the medical staff really faced big problems during the pandemics. Of course, we have to make these sacrifices, and we had to try to do. But of course, the methods can be discussed. They can be improved. They can be amended. Of course, we are all serving and the same purpose, and we are have a common purpose which unites us, and I think that normalization also is a target which brings all of us together. We all agree on that. Now, so let's put aside the political differences and divisions and try to get together to see how we can get rid of this pandemic. So we try to make all the integrations required during the pandemic when we had an integration with the Ankara municipality for public transportation. We tried to get together with all the actors, and of course, we may not have been able to consult. Of course, the methods can be discussed, but I think that we can be excused. We tried really our best. We this, for example, we made an integration. If you enter public transportation, where you buy a ticket, a bus ticket or train ticket, or go to a shopping mall, or get any system where a health code is required, you can be sure that the ministry at the integration, not only for public hospitals and public health centers, we have been connected with during these pandemics with 6 ministries and with the actors which were implicated within the system. Because when we look, we says, okay, if the health code, we want to say, okay, the health code has been checked, but if the Ministry of the Interior does not have the possibility of checking, so that will remain on the paper. So I think that every phase, every actor has to be taken into consideration, and we try to make it in a more as complete as well. I hope we have been successful. Of course, we are aware that there are always some that's and we are trying to do our best to we have a team, really a team of like yeah, you can see maybe a few people in front of the cameras, but you have people behind the wall, hundreds and thousands of people working on the computers, working on their desks, and working try to see how they can develop and how they can improve the situation. I think that all the health staff and some people which are a bit invisible, the people who work on the technical stuff, and I want to thank all of them for their contribution. Thank you. Thank you, İlker Bey. I have worked with, I didn't know that there was a service for children with special needs, and I think that is really, really. This is how we can learn, you know, like talking to each other. Thank you very much. Now, Professor Zeki, what do you think? Yes, we cannot hear you. When you look at the resistance of the public resistance, now, of course, we talk about social distance, about these urbanization policies, planning of parks and open areas. It says, okay, don't go out. But it's okay that if that what should if well, okay, if you live somewhere in the suburbs, you cannot take a bus and go to the Bosphorus to take some sea air. So of course. For example, think of a big parking lot. It can be transformed into a health center. Yes, you can have the mobile systems, like the modular systems, to go. Like, first, you have to protect the forest, and I think that, you know, this also wildlife has been under the impact, and we think that you have to have a balance. Like people should be able to move, get fresh air and protection of sensitive groups like the migrants, the refugees, the children, and the elderly people. When we look now, when you look that, I think that if the social capital should be like, yes, you're going and you. He has somebody. He's not someone who is not well dressed, and he wants help. Now, if you're afraid, means there is that a social thing. Now, they said, okay, let's help him. So it's like you trust him, and mortality also decreases when there is of course, the social economic lack of balance creates disease. Of course, we all know that. In these pandemics, who did we see on the field? Who did we see in the hospitals? The nurses. It says the nurse. Well, for the health stuff, is like the nurse looks for us is like the assistant to the doctor, but it needs discipline. Nurses. Their statute has to be developed. I think that is just a simple helper, but I think nurses are the basis of the health system. Now, how do you, of course, if he's on the field, first step.
Bizde yasasında öngörülen esas olan birinci basamaktır. Yasayı biliyor musunuz? Birinci basamak sizi sevk etmezse hiçbir yere gidemezsiniz. Giderseniz de para ödersiniz. Daha yüksek para ödersiniz. Bence doğru bir yaklaşım bu. Ama çeşitli nedenlerle uygulanamıyor. Buna birçok gerekçe söyleyebiliriz. Ama gerçek bu. Çünkü bütün sağlık sorunlarının %70'i 80'i birinci basamakta çözülebilir. Siz bunu yapmayıp da teknolojiyi öne çıkartan bir şey yaparsanız ne olur? 1 kuruşluk şeyi 10 kuruşa mal edersiniz. Aşırı pahalı bir sağlık sistemi. Mesela şu anda Türkiye para olarak sağlıkta çok az harcıyor görünüyor Amerika'ya göre. 8.000 dolar, 1.000 dolar diyelim, çok kabaca söyleyeyim. Ama biz aslında Amerika'dan daha fazla sağlık tüketiyoruz. Bu sadece fiyat farklılığı. Yani biz ortalama Türkiye insanı daha çok muayene oluyor, daha çok ameliyat yapılıyor, daha çok BT çekiliyor, daha çok MR çekiliyor, daha çok ameliyat oluyor. Ama maliyet başka nedenle düşük. 1.000 dolar, 8.000 dolar. O zaman biz eğer Amerikalı kadar tırnak içinde sağlık hizmeti alsaydık bütün bütçemizi sağlığa verecektik. İşte bu sağlığın örgütlenmesi konusunda bir şey bunu söylemek istedim. Dolayısıyla da başka bir şey daha gördük. Rutin hizmetlerin devamlılığı. Evet, bu da çok önemli. Sağlıkla mücadele, yani bu pandemide başka bir şey daha oldu. Rutin hizmetlerimiz aksadı. Kim ne derse desin. Belli ölçüde aksadı. Tam bunları biz ölçemiyoruz. Ama mesela acaba kronik iskemik kalp hastalarımız daha erken öldü mü? Acaba meme kanserli ya da akciğer kanserli hastalarımız daha erken öldü mü pandemi öncesine göre? Bunu tam ölçemiyoruz ama muhtemelen öyle etkileri var. O zaman rutin hizmetlerin, pandemi hizmetleri, rutin hizmetlerin devamlılığını sağlamak da bir konu ve burada eğer siz birinci basamağı iyi çalıştırabilirseniz, hakkını verirseniz birinci basamağın, onore ederseniz, orasının hekimliğin esası olduğunu söylerseniz ve bunu desteklerseniz çok daha ucuza bir sağlık hizmeti alabilirsiniz. Mesela siz aynı şeyi öksüren hasta hastaneye gitse 10 liraya çıkar. Halbuki aile hekimine gitseydi 1 liraya çıkardı. Ama tabii ki burada atlanabilir şeyler olabilir mi? Ama o aile hekimi eğitilmesi ve meslek için sürekli bir eğitim sağlanıyorsa bunları geriletebilirsiniz ve çok daha etkili toplumun içinde bir yandan hastanelerde diğer hizmetler devam ederken birinci basamakta temel pandemik hizmetlerin devam edebileceğinden emin olabilirsiniz.
Now, when you look at the flexibility is important, and of course we talked about human rights and yes, well, I wanted to be brief, but maybe I talk more than. Thank you. We talk about the social capital and fairness. Then thank you very much. Yes, Professor Levent. Now, there was a question concerning the handicapped and the elderly people had to stay home. And the other one is the project that how can we make a union of cities? Maybe that is a question addressed to you. Microphone, please. Thank you. Of course, the handicapped and the elderly. of course, they it is not we talked about a system. When we look at this, we see that the handicapped and the elderly people, what are the hurdles? What is preventing them for having access? This is what we make, how we make the planning, and then when we have problems, and of course, when there were some problems, health problems for the handicapped and the elderly, like for concerning sports and physical activities, the problem is that it is not going to be solved by sports centers. The handicapped and the elderly, they keep that the green areas in the district where they live. So if in their quarter and near them, if they could within walking distance, so I would think of sometimes projects. Now, for a handicapped person, he has to needs transportation, but to reach a green area, a park, or so they. But when we look at projects and and in Kocaeli, the social services department has made a project in cooperation with the universities for the handicapped. They take them to a sports center, so they have a possibility of participating into sports activity. But of course, there are also some rules during the pandemics. Of course, they were also handicapped, and we talked about the Ministry of Sports, but it is like the Ministry of Youth and Sports, and have the impression that sport is only for young people. But I think that maybe youth should be another department, another ministry, and sport should be another. So, of course, youth is dominating in these activities. Now, if you come, it says that how old is the patient? Now, of course, the age of the patient sometimes can become a problem. So the elderly and the handicapped and their access to sports system. So we have to, I think that local administration have to act actively. Of course, the clubs where they have separate clubs for the normal people and the handicapped people. We have to see what can be done. Yeah, we have to have rules like if the e-sport club should have the number of handicapped people, like a quota of handicapped people. They say they have to do, and if they don't do that, there will be some measures taken. Maybe that could make it more efficient and more practical. I think that municipalities and local administrations have to be active in this field. Another, the Union of Cities, of course, So the municipalities have to participate, and sometimes maybe you have to have a protection projects like the Union of Cities, especially concerning public health and to bring them together regionally and to have a regional planning and when it comes to the sports clubs of the municipalities, say from local to regional development, and I think that of course the Union of Cities they have to prepare projects. There was the Marmara Municipality Union. They prepare projects. Yes, I am very interested in the project that do the Union of the Municipalities of Marmara, which come together and try to make joint projects. From time to time, we go to meetings and says that this has to be done. Everything is on paper. Everything that needs to be done is on paper. It is within the regional plans, the development plans, but we have a problem in implementation. Yes. Yes. Now, we have to do that, and we have to implement what is for the time being project. I think that's very important. And thank you very much. Thank you, Levent, Professor Levent.
No, I'll keep it short. It's fine. Thank you again for all of the other panelists. It was really, again, to have your comments again was very insightful. I mean, one thing that continues to emerge is we're all aware of these barriers to access, but that this remains something that needs to be accounted for in future kind of policy. And I mean, Levent just said this, it's very potent, and we say this a lot in migration scholarship, something maybe a right written into law, but it's not implemented. You still face the barrier when you're going day to day, sometimes to access the hospital or access a vaccine, or in other cases, education, etc. And so this gap, we are aware of it, and we still need to do more work to address it. One thing, İlkay, like you were mentioning, what has been implemented to kind of address the diversity, but the Ministry of Health, recognize that there's this diversity, but it's not in a sense a critique, because we didn't predict this pandemic. We couldn't have forecasted how it would happen, what would happen, how long it would last, but it's more kind of thinking going forward, how do we make actual policies that will affect, different people? How do we account for these differences? How do we account for this diversity so that in whatever comes next, there is more preparedness? And we don't, again, think one size, fits all, just kind of accounting for that. Zeki Hoca, yes, thank you for, again, bringing up, yes, social determinants of health affecting health, yes, and that this is at times kind of ignored, as if, again, there's this equity among how we approach bodies and people without accounting for the socioeconomic factors that can account and really affect people's health. And I'll stop here, Jana. Thank you so much.
Thank you, Sot, and thank you for all the panelists. Çok böyle tadı damağımda kalan bir konuşma oldu.
Yes, of course. Yes, I try to take notes, and I would like to thank the Union of Marmara Municipalities Union, and I would like to thank all the speakers and all who have participated. Thank you. We have 1 minute, and we have to leave because of the parallel. Now, I would like to give the last words to. Sorry, the time is limited, so.
Marmara bölgesinde göçmen sağlığı ile ilgili bir istiyorum bu konuyla çok ilgileniyorum tüberküloz kontrolü nedeniyle.
Yes, in the Marmara region, of course, I would like to participate in one of the meetings and
böyle bileklik takılı insanların sağlığıyla sistem arasında ilişki kurulu. Siz dediğiniz hani video sistem.
When we look at the system, so
büyük caddelerine şey kurulabilir.
like
Acil durumlarda
in urgent cases, like
solunum sayısını, oksijenin saturasyonunu,
maybe like in the like you can also take blood or make checking. So maybe bring people to these urgency centers which are accessible. The digital health. Maybe you can do that, and it will be practical. Yes, yes, we're working on that. Yes, yes, these are questions that we are taking into consideration. That like health technologies and the experts are also mentioning, like a phone booth where you can have these primary checks. We are planning that. And the problem, since accessibility for the time being, it is expensive. Now, yes, yes. Well, maybe you can cooperate with the municipalities. If not, the NGOs will interfere. Yes, it is. Yes, yes, it is a bit expensive, and we are. I hope that will be realized. We wish to thank all the participants to the panel. Thank you for your participation and for sharing your ideas. And I know you have to leave now to other rooms and other panels. And thank you very much for your presence and your contribution. Thanks a lot. And thank you for the excellent moderation. Thanks a lot. Thanks to all of you, and hope to meet you again soon in healthy days. Thank you. Thanks a lot.